Canada's population continues to grow and it's also aging, putting more pressure on our healthcare system. Well, there is an increasing need for nurses, but apparently the profession seems to be suffering some burnout and is in need of more recruits. So joining us to shed some light on the issue is Emmanuelle Faubert. She is an economist with MEI, the Montreal Economic Institute. Great to have you with us, Emmanuelle. Welcome.
Thank you for having me.
So, Emmanuelle, you recently did a study on this called The Evolution of the Nursing Supply in Canada and young nurses leaving the workforce at an alarming rate, especially in Alberta. What are you seeing here? What's going on?
Yeah, so essentially what we did is we looked at the ratio of how many young nurses under 35 did not renew their license to practice in each province for every 100 nurses under the age of 35 that did newly register to have their license to practice in a certain province. And what we found is that in Canada as a whole, in 2023, for every 100 new nurse under 35 that joined the profession, there was another 40 that did not renew their license to practice in the country.
So, why are so many young nurses leaving? What's going on? What's the issue?
Well, as you said in your presentation, essentially a lot of it is working condition issues. We're seeing a lot of not only anecdotally, but when there's surveys done with nurses asking them what is the problem, the most recent survey done by the Canadian Federation of Nurses has shown that a third of survey nurses had done mandatory overtime in the last 6 months. A staggering 59 had been victim of some form of violence or abuse in the last year, and a quarter of respondents showed clinical signs of anxiety or burnout. So what we're seeing is that the working conditions are so poor that we're burning through our nurses, leading them to eventually not renewing their license and in many cases just leaving the profession altogether.
Oh my God, that's alarming. So you were saying that the stats say that 60% of nurses experience some form of violence or abuse at work. That is very concerning. Any ideas on how to make the work environment safer?
Well, that's the thing. We're in a situation where there's a shortage of healthcare professional in all matter of healthcare professional and especially nurses. So what we're seeing is that everywhere is being understaffed, leading to people not being able to receive the care that they need and putting nurses in a situation where they are rushed. They need to provide crucial care to patients, and it puts them in a dangerous situation. So what we need to do is, first of all, attract new nurses, but most important, we need to make sure that we retain them and make sure that nurses want to stay, because what happens if we burn them out, then they're going to leave. And then nurses leaving puts more pressure on the remaining staff, burning them out even faster. And as the reputation of the profession degrades, we're going to have even fewer people interested in joining the nursing profession. So it creates this vicious cycle. So we need to tackle working conditions, all matter, working to improve the cases of violence, reducing as much as possible, but also talking about flexibility of scheduling, about professional autonomy, all things that improve work-life balance, makes nurses more satisfied professionally and more likely to remain in the profession.
Mm-hmm. When we're talking violence, are we talking patient to nurse violence?
I would say any type. It's not specifically mentioned from patients, or it could be maybe from, it's just in general.
Mm-hmm. How short are we on nurses? I know a quick glance online, and there are dozens of nursing jobs available right here in Lethbridge, where I am.
Mm-hmm. So what we're seeing is that there's an increase in job vacancies in the nursing profession, where we went from 13,178 in 2018, and now it has tripled. In 2023, it went up to 41,716. So what we're seeing is there's an increasing number of jobs, meaning that there's as you said earlier, there's more care that is being demanded and required because we have a growing population, an aging population, and simultaneously, we do not have the numbers to fill all of those postings. So more and more pressures is being put on the staff.
Does the government need to train more nurses in our colleges? Would that solve the problem?
We do need more nurses trained, of course, but it doesn't matter how many we train. If we're not able to retain them, we're not going to fix the issue. And that's why we need to ensure that working conditions are improved and made more viable as a whole so that nurses will want to remain. Because the reputation of nursing for having bad working conditions, this is nothing new. This has been known for years, I might even say decades, and there's still people
Yes.
going into nursing every year, tens of
Hmm.
thousands every year. Why? Because this is what they want to do. They want to dedicate themselves to treating people, and this is great. But we need to make sure that we keep the people that we train. Otherwise we're not fixing the issue.
Yes, that's a good point, Emmanuel. I was going to actually bring that up because this has been happening for decades. My mother was a nurse, an RN, and I remember stories about her being one of the only nurses on an entire ward. And it's just that staffing shortage has sort of always been there, and the burnout as well. And I have seen a study. The study notes that BC had the best retention rate for nurses. So what are they doing that is benefiting nurses that say Alberta isn't?
So what we found interestingly in BC is that for every 100 new nurse under 35 that entered the workforce, there was only 27 that did not renew their license. So this was very promising and interesting. And what we found is that first of all, they're able to retain a large proportion of the nurses that they train. The most recent data from CIHI, Canadian Institute for Health Information, show that in 2023 they retained 93% of their trained nurses. So this is great, but also they're able to attract nurses from other provinces. And essentially, when we looked at why and looking into that and asking nurses and nursing associations in BC, they seem to have a different approach when it comes to not only attracting nurses but keeping them. For example, they focus largely on making sure that the transition between studying nurses and working in the profession is done as seamlessly as possible, as this transition can be very difficult emotionally and financially. As well, they have implemented some programs to simplify the possibility of obtaining a license to practice in Canada when trained internationally. Another thing that they have done to retain their nurses that was very interesting to us is that they implemented this system called the job sharing pool, where they create teams of nurses where inside those teams, nurses can trade shifts in between them without having to go through bosses or the bureaucracy, giving nurses more flexibility and control over their schedules, things that help then, after that, reduce burnouts, job satisfaction, and improve retention as a whole.
Oh, I like that. And you have suggested that allowing nurses that greater freedom to work for private clinics would provide greater flexibility for them to perhaps find a better work-life balance as well, right?
Definitely, because different nurses, they are human beings like everyone else, and so they have different needs. So both systems have advantages and disadvantages. In the public system, for example, you have often more stability, job stability, as well as, for example, pension plans that are because it's part of the public system. However, it often comes with harder working conditions and less flexibility and autonomy. However, in the private system, then you have less of that job security and stability, but you have more flexibility, autonomy, and freedom. So different nurses have different needs, and having the possibility of both allows nurses to choose which one is right for them. As well, the private sector often acts as a safety net to retain nurses, burnt out nurses from the public system that would otherwise leave the profession altogether. It has as a last option, one last way to practice nursing without before ultimately making the decision to completely change career.
Interesting. The government has kind of a monopoly on healthcare. And the study suggests that if we had a free market in healthcare, the market would respond to the demand for nurses and employers would improve the working conditions to attract and retain nurses.
Exactly, this is what happens when a market is allowed to do what it does best and it adapt. For example, when we had the worker shortage more generally right after COVID, what happened is generally you're going to have increased salaries, and then you're going to have companies fighting and being in competition to attract employees. So yes, you have increased salaries, but you also have increased benefits, increased better working conditions. There are adaptations that are made to attract people and then retain them, because if you have someone but another company offers better working conditions, they're going to go there. But when you have a monopoly or a sector that is maybe not completely a monopoly but heavily controlled by one entity, in this case the government, the market is not able to fully calibrate and adjust to those changes in supply and demand. And then that's why we have here, which is a paradox, you have such high demand but the working conditions are not being changed, are not able to adapt.
Emmanuel, in most provinces, it seems that any move towards private healthcare brings up opposition from politicians, not to mention unions. So, any thoughts on whether or not that mindset is changing?
Well, and that mindset is unfortunate and damaging, because let's be real, it's not black and white. It's often the excuse often used to try to push against the independent sector is that it would cost more, but the reality is it's not black and white. In some cases the public sector would be more advantageous financially, yes, but in other cases, in other job postings, for example, when it comes to replacing people, temporary workers, just for example, during the holidays or during the summer season where people like to take vacation, it is less expensive to go for a nurse in an independent agency than rather to have people on the full payroll. So both sides can be advantages depending on the circumstances. So just saying globally that travel nursing and independent nursing is bad is flawed, because it's not the truth. You have both good and bad in both sectors, but the importance is that having choice, having the possibility of both, ensures that we fill the gaps and then we're able to provide the care that the patients need.
Mm-hmm. Where do you think that we'll be in 10 years? Where do you think the nursing supply might be in a decade?
Well, it really depends, because we're at crossroads right now. If we continue without changing anything, and we continue burning out our nurses, then we create a double downward cycle, as I mentioned earlier, where you burn out the nurses that are already there, that stay, and then this is becoming less attractive to new nurses. So you end up with a system that will not be able to sustain itself long term, because let's be real, the young nurses of today are the experienced nurses of tomorrow. So we need them to stay long enough until retirement, ideally. And then
Sure.
that's the worst case scenario. But if we're able to make some changes to the working conditions, make sure that nurses are able to flourish more in their profession, and we reverse the trend that we've been seeing in over the last 10 years, then we will be able to retain more nurses, attract more nurses, and then we're going to be able to provide the care that people need. So we really need to make sure that we reverse the trend if we want a sustainable healthcare system in the long run.
Thanks so much for being with us today, Emmanuelle. It was a great conversation.
My pleasure.
Emmanuelle Faubert is an economist with the Montreal Economic Institute. I'm Jeanette Roche on behalf of all of us here at Bridge City News. Thanks so much for watching.